Hello, my name's Eleanor Hayes from Birthzang, and today I want to talk to you about BRAIN. This is a very helpful acronym that can be used as a way to help you make informed decisions during labour and birth. Sometimes during labour, things happen that just seem a bit unexpected. Your labour's not really progressing very well. Perhaps the baby's showing some signs of distress, or there could be all sorts of reasons why your care providers may suggest to you that you want to take some interventions in the process. Many of these, it's hard to plan. You don't really know quite what they're going to be until it happens to you. And sometimes it's hard to know whether or not it's the right thing for you to do. And the BRAIN acronym is a really useful tool to help you ask the right questions about that intervention that's being suggested and help you come to an informed decision about whether or not you want to go ahead with that intervention. So what does the BRAIN acronym stand for? So first of all, we've got B, which stands for benefits. What are the benefits of doing this intervention? How is it going to help me? How is it going to help my baby? This is a really obvious place to start. Secondly, we have the letter R, which stands for risks. What are the risks involved in this intervention? What are the risks for me? What are the risks for my baby? And a lot of the time, certain things like certain pain relief, for example, an epidural is, seen as a great way to relieve pain during labour, but actually has quite a lot of risks involved. So it's important to understand exactly what you're agreeing to, both the pros and the cons. So third on the list, we have A. This stands for alternatives. What are the alternatives to this treatment or intervention? It could be that there's a pain relief that's less invasive, that's not going to affect your baby so much. If you're being offered an induction, for example, to speed your labour along, are there other things you can do to try and speed the labour along before you get to the point where you're having a chemical induction? So it's very helpful to ask what alternatives there are. Then we have I. This stands for interventions, or probably a better way of putting it would be, are there other interventions that are likely to happen as a result of having this intervention, this first intervention? So, for example, to go back to the example of having an epidural, is it more likely that having an epidural is going to lead to other interventions? And the answer is quite often yes. So, for example, if you do have an epidural, you're much more likely to require assistance in your delivery with forceps or ventouse, for example, and your risk of a caesarean section also increases because of the position that you are in lying on your back. So it's very, very good to understand what the implications are likely to be for that intervention. Then lastly on the list we have N, which stands for nothing. What happens if we do nothing? What happens if we just wait for an hour or two and see what it's like then? Is it just a case that, we're not adhering to your timetable, or is there actually a genuine concern for myself or for my baby? So doing nothing can sometimes be a very, very helpful thing to do in labour. So I hope that this BRAIN acronym, benefits, risks, alternatives, interventions, or nothing, can help you make informed decisions during your labour and birth.